Thank you for the opportunity today to talk to you about the first ever Australian Acute Coronary Syndromes Capability Framework to support the provision of evidence-based care across Australia. My name is Dr. Karen Page and I am the National Manager at the Heart Foundation for Health Equity. The key principle that underpinned the framework was that no matter where you live or present to the health service, you have access to evidence-based care. Other important principles are that there are formalised system linkages across hospitals that enable effective transfer of patients and good clinical handover, and that in no way does this framework replace clinical judgment or local legislative requirements. Key objectives underpinning the ACS Capability Framework were to support the implementation of evidence-based care as articulated in the Heart Foundation and CSANZ Clinical Practice Guidelines, and more recently in the Australian Commission on Safety and Quality's ACS Clinical Standard. Another key objective is that the framework enables and guides health service providers, decision makers, policy officers about the capacity required to deliver good evidence-based ACS care and to thereby improve coordination of care so that it matches patient level of risk with appropriate care requirements. The ACS Capability Framework was developed through consensus with key experts and consumers. There were 3 rounds of formal consultation. At the end of the consultation, 4 service categories had been identified with their associated capabilities. The 4 services categories are pre-hospital emergency care, which includes retrieval, ambulance services and services such as bush nursing centres. Category A, these are your smaller regional or rural hospitals that don't have a formal emergency department but do have an emergency service. Category B, these are your larger hospitals that have an identified emergency department but no interventional cardiology on site. And then Category C, which are your tertiary cardiac care centres. They obviously have interventional cardiology and access to cardiac surgery. For each of the service categories, we have identified the service capacity under several headings. One is the key services they provide, the appropriate service linkages and communications, workforce, support services and clinical governance. The service capacities that have been identified are at a minimal service level. It is important that each health service recognises under the new ACS clinical standard which statement they are going to provide. The Capability Framework can provide you with this information. Hard copies are available via the Heart Foundation or via the Heart Foundation website. The Heart Foundation would like feedback regarding the ACS Capability Framework as part of its quality improvement. There will be a link on our website to enable this. Thank you for your interest in the ACS Capability Framework. If I can be of further assistance, please contact myself, Karen Page, at the Heart Foundation at the email on your screen. Thank you for your time.